we have a content level question. Okay, for a content level question, you have to analyze it. And I put it in a SATA form so that you can see that you won't be scared about SATA anymore. So SATA question, what you do, you read the last portion of the question. Which assessment finding should the nurse expect for such diagnosis? There's a bunch of words there. I'm going to break it down. All I need to reframe it into my own word. What I'm doing is expected finding. That's all. So then I read the rest of the question. A nurse assess a patient who presents to the dermatology clinic with concern about malignant melanoma. Okay, bunch of words. I see malignant melanoma, and he's worried about malignant melanoma. And the question is asking you, which assessment will you find that will the nurse suspect for such diagnosis? That means I'm looking for expected finding for malignant melanoma. You see, I've broken it down into 2 lines. If you have malignant melanoma, what should I expect on physical exams? That's all. 3 lines, I have 2 words. So then I'm going to use these 2 words to evaluate each answer. Each answer is independent of the other one. So A, B, C, D, E, F, they are not answering all these questions. I'll say to my mind, I know you cannot, if you can cover it, if they give you a paper and you can cover it, but I know you can do that, but cover the answer choices in your mind, saying there is only one answer. So I'm dealing with A. I answer A, and I'm making a decision. I'm not leaving until I make a decision. After I make the decision, I'm not going back to it again. Because if you start, you see one answer choice and you leave it behind and you go to the next one, you start comparing answers. And that is not the idea of in SATA. That's not the idea when they set the exams. They want you to answer one question. So the way I see SATA is you only have one answer per question. So your chance of passing is 50-50. What we're going to use to answer is expected and melanoma. This is where your content has to come in. This is a content, classic SATA content question. All they asking you is, somebody have malignant melanoma, what do you see? And if you have a good content, you know that melanoma is A, B, C, D. That's what you use to answer that. A is asymmetry. That means it's not the same. Okay, so you're looking for something that is asymmetry. That means it's melanoma, it's a cancer. B, okay, you have unequal border. So the border is not normal, irregular. So you say irregular border. C, the color is not the same, different colors. So it has different colors. And D, the diameter is greater than 6 millimeters. And E is the shape, okay? The whole thing is not smooth. Not smooth. So it's not even, okay? Not even. So it's not even across. Some areas has bumpy areas, and areas it's flat. So this is the key for melanoma, basically. A, B, C, D, E. It's so simple to remember it. That's the way, anytime they give you melanoma, it should satisfy this requirement. So, first one, I'm only looking at A. I'm not even thinking there's B and C there. It said irregular border. Yes, it makes this criteria. So this is right. I've done it. I make a decision. I'm not coming back. Uniform color. Yeah. If it's uniform color, here it said the color has to be what? Different colors. So this is wrong. It doesn't show melanoma. About 5 millimeters. I know it has to be greater than 6 millimeters. So I can't say that. Lesion has been the same for 6 months. That means it has no change at all. No change. Well, This has no change. This he's not smooth, and he has to change for some time. He has not remained the same. So this has remained the same. It can be uniform throughout. Well, it's not. It's uniform. It has to be non smooth, not smooth. Okay, it shouldn't be even, not even. So if it's uniform, this is the same level at the skin. It's the same thing. He's talking about this. The same thing. It's the same level. It has not changed. It's the same size, or you can even say symmetry. It looked the same around when you divide it into two. So this is gone. So there's only one answer that is, and you can see I intentionally said it that way. So you can know that you can have a set of question that is only one. And so that's why when you start comparing, you get it wrong. But this is straightforward content. Like you know it, you just apply it to answer the question. So for this one, it's not SATA. So you read the same thing, read the last portion. And next, we suspect which of the following as the possible cause. So suspecting is the cause. So I expect this is expected finding. That's what it means. I suspect which of the following as the possible cause. So what will be the diagnosis that is going to cause this problem? And next assesses a client and noted what? JVD, jugular vein distension and shortness of breath. So a bunch of ways. I see JVD and I see shortness of breath. Okay. What diagnosis? So I'm looking for diagnosis that I will expect for this. Somebody neck is distended, so and he has shortness of breath. JVD, you got to interpret it. This is just an interpretation, content level. Whenever you see JVD, what does that mean? It means it's fluid overloaded or central venous pressure is high. Usually it's 2 to 8. This is your content there you have to know. If it's high, it's greater than 8. And when it's high, it means you have too much fluid. And then if you have too much fluid, you can have shortness of breath. So I've broken the question down into one thing. All the values they've given me, they want you to change jugular vein distension into another word. That's all, interpretation. And the questions is long, but I've changed it into two. I'm using my content to break it down, and I know it's fluid overloaded. So I'm taking that information, I'm looking at the answer and said, okay, which one is fluid overloaded? Diabetes insipidus. You know that DI, you need your content to answer this. DI is they don't have ADH, so they lose a lot of water and they get dehydrated. Well, I'm looking for fluid overload, so this is wrong. You have dehydration here, wrong. SIDH, yes, they have ADH, so they're absorbing a lot of water. You're using the content that you know, so they absorb a lot of water and they get fluid overloaded. They become dilutional hyponatremia. So they're likely to have IGP and JVP, and if the fluid overloaded, they will have shortness of breath. So this is my answer. Thrombophlebitis has nothing to do with it. So you see, you're just applying your content in a different way, but you have to analyze the question and break it down into the way you know it, but you just have to put it in words. Just putting the questions in words. So what is he asking? The same thing, last portion of the question. Which level of intervention is the next engaging in? So that means I have to make a diagnosis of intervention. And he said, and next recommend a mammogram to a middle-aged woman on mammogram due to her age. I made a mistake here. Recommending mammogram to a middle-aged woman due to her age. Which level of intervention is the nurse engaging in? Then you go back to your content. You got to go back to your content and said, what are they asking me? What is primary prevention? And you go back and say, primary prevention, you're doing something to prevent the disease from happening. So you usually is easy. I call them EAT. That's what the NCLEX does. Education, teaching. Okay, so education, teaching, and then immunization. That's all. Education, teaching, and immunization. So anytime you involve in this, you're doing primary prevention. That's what the NCLEX does. So you educate them. You got to you do what? To lose weight. You got to exercise so that you can lose weight, so that you don't get hypertension. You should cut down salt in your diet so that you don't get hypertension, right? You don't smoke so that you don't get what? Lung cancer. You should get your flu vaccine so that you don't get sick when the flu comes. You should get your COVID vaccination so that you don't get COVID. So those are the things you do when you do primary prevention. Then secondary is one word. You see, just break it down. There's a bunch of words when you read in the textbook, it's one word. Screening. If I'm screening, I'm doing secondary prevention. Tertiary, okay? Tertiary, what you're doing is patient already have the disease. So I'm treating it so that they don't get what? Complication. Trying to prevent complication. Treat the disease so that they don't have complication. And then quaternary is basically you don't want to do anything to harm the patient anymore. So you prevent harm to the patient. Sometimes you can't find out what is going on, so don't do anything to harm the patient. Let the disease process clear itself. So I'm breaking the question down into a content level. Then I go back and said, all they asking you is to the definition of this, but they don't tell you. They give you a bunch of words, and then you be like, what? They ask you which level of intervention is the NCLEX engaging. So the last portion of this question give it away, that then you have to read. If I said go get a mammogram, then I'm telling you, and that is a screening process. Okay, if they tell the NCLEX tell the patient go get a mammogram, it's a screening. Go get a mammogram, it's a screening. I'm not teaching you that, because what you're going to do is you're getting the mammogram to look for cancer. So that's a form of screening. So this answer is that. So it's B. So that's secondary prevention. So now we shift gear to signs and symptoms. Sign, like I told you, select all that apply question is signs and symptoms, education, teaching, and sometimes risk factors. So you got to, when you're studying, pay attention that you should write down every disease process. Just write it in the paper and say, this is the signs and symptoms. This is the way I'm going to teach them. This is the way I'm going to intervene. But they are connected. If you know the signs and symptoms, you can teach the patient what to look for. So now let's go. Which of the following diagnoses the nurse should suspect? So the same thing, expected finding, something that I should suspect. A client presents with gradual loss of peripheral vision. Okay, a bunch of words. Gradual loss of peripheral vision. Which diagnosis should I suspect? Okay, then I said, okay, I write it down. Gradual loss of peripheral vision. And then what should I expect? Which of these? You look at the answer choices, there's a bunch of diagnoses. I don't know. So I will give you the easy way to answer this question. So for retina, you see they did not put any pain. This is an acute onset of pain, and they usually they have like floaters, or they will see like a spot, or they will see like a blind spot, okay, completely. Retinal detachment. There is nothing that, or they see like a curtain, like something is falling in their eyes, okay? Getting like sign. It's like something is coming down on their eyes, like a curtain. So those are the keywords. Acute onset, blind spot, curtain-like, or floaters. They see something is floating in the eye. The question said what? Gradual loss of vision. Therefore, That one is gone. Then you go to catheter. That one is just the cloudiness of the lens. Okay. So if the lens is cloudy, well, I wear glasses. It's blurred. You don't see well. When you think about it, when your eyeglasses is foggy, that's what happens. You get blurred vision. This has no answer. It's a gradual loss. Glaucoma, there's two types though. This one did not tell you, but you know one of them is loss of peripheral vision. So they lose their peripheral vision. And that one is the open angle glaucoma. And that one is painless. So this one is painless. Then the closer one, the closed angle glaucoma, that one is very painful. So there will be acute onset, painful. It's very painful. Loss of vision right away. That's emergency. But they never told me that. Okay, then TIA basically is like mini stroke. So slight vision, neurological changes, you become blind, dizzy, and then you had a mini stroke, basically transient ischemic stroke. This does not say that. Gradual loss of peripheral vision. And macular degeneration, that's what they used to confuse you, because that one is not peripheral, even though that one is gradual, it's gradual loss of central vision. So that's how they're going to get you. This is the central vision, but the peripheral vision will remain the same. So based on what you know, you've used that to answer signs and symptoms, you see, and it requires the pathophysiology of the disease. So we know this is wrong. Okay, we know this is wrong. We know this is wrong. We know this is wrong. This is wrong, and this is the right answer. You can use the same thing. It doesn't change. So SATA, we're going to use the same thing. Read the last portion. Which assessment should the nurse include in the evaluation concerning the medication? So assessment I have to include. So my plan, okay, that's my plan. And then a client was prescribed amitriptyline for chronic back pain. So he's on amitriptyline for back pain. Okay, what should I include? Then you go back, you sit down and say, before even you look at the answer, what is amitriptyline? You go back to your content, you know, this is anticholinergic. Okay, they can use it for back pain. It's a TCA. So amitriptyline this is a TCA. Okay, and TCA has a lot of side effects. Okay, they have, and the way I remember them, so it's a TCA, and it has side effect. TCA is one of the medication that has a bunch of side effects. And the way I remember it, before you look at the answer, try to remember it, is I call it the TCA dance. So they have skin lesion, dermatitis. So, and then the A is the anticholinergic effect. And the N is the neurological. So any neurological stuff. And the C is cardiac. That's the way I remember TCA. So you got to do the TCA dance so that you can remember the side effect. And the E is evaluate for the dance. So evaluate for the dance. It's the dance, DANC. So they have skin lesion, anticholinergic, and neuro and cardiac and evaluation. Then you go back and you said, okay, now let me answer my choices now. Biofrequency, I need to assess them. So if they be on this for a long time, I ask them, hey, how are you pooping? Or because you know anticholinergic, what is anticholinergic? You can pee, bowel movement, slow down, saliva, vision problem, all of them. Secretion goes down. So this is anticholinergic, and you use it to, because it's one of them. Bowel, why do I need a bowel assessment? Yeah, that's anticholinergic. So this is good. I need that. So I need that. Urine frequency, yeah, that's related to the anticholinergic. Quality of their vision. This is vision. Yes, I need that. Confusion. Yeah, that's neuro right there. EKG. Well, it's a cardiac. They have cardiac arrhythmia. I should get one. Skin evaluation. Yeah, dermatitis. So I intentionally said it this way so that you know you can get all of them right. Don't worry. If you're following the technique, it doesn't matter. So far as is answering, you using your content to answer the side effect and of the medication, it doesn't matter. It's a pharmacology. Don't worry about it. Just stay with the program and say, this is it. I know TCA is, I'll have to look for dance. It's over there. I'm not going to compare any answer choice. And I keep on going and make a decision. So that is for that one. Signs and symptoms question. The same thing we're going to do. So which assessment findings the next should expect? The same thing, expected finding. Okay. Then I read the first one. A 10-year-old boy client with diabetes was diagnosed with diabetic ketoacidosis. Okay. I have a kid with DKA. What assessment finding would I expect? So in a DKA, then you go back with your content and your pathophysiology. DKA happened because of what? No insulin. Usually in their sick days, they don't take insulin. And because they don't do that, they say, well, I'm not taking my insulin. I'm not going to eat. I'm not going to drink. And their sugar goes up, it goes above 250. And then your body said, no, we got to do something about it. And so the sugar that goes up become osmotic diuresis. So they become dehydrated from that. And then the body, if there is no, you need insulin. You need insulin to put sugar into the cell for the cell to use it. If there is no insulin, you cannot put glucose into the cell for the cell to metabolize it to give you energy. So what the body does is, okay, fine, we don't have insulin to push glucose in, we're going to use fat. So they break down fat, and then the breakdown of fat to make energy give you the ketone. That's why they form ketoacidosis. But then, because they make ketoacidosis, they are metabolic acidosis. They've created metabolic acidosis. So you should expect their pH to be what? Less than 7.35. That's one key. Now, their body want to compensate. So metabolic acidosis. So when they give you the lab work or a acid-base issue, look at it and see what they've given you. If it's a metabolic acidosis, you check the first one. Metabolic problem, how do you fix it? Respiratory. If you have respiratory problem, how do you fix it? Metabolic. You got to go back forth. So you have metabolic problem, and yeah, then my body has to do a respiratory problem. So I do a respiratory. If I have acidosis, I have to go opposite. I go alkalosis. So they're going to have respiratory alkalosis. And how does that, what is respiratory alkalosis? That they want to blow out their CO2. You got to get rid of your CO2. That will give you respiratory alkalosis. Most people who are hyperventilating, they have respiratory alkalosis. So these people will start breathing fast, deep, rapid breathing, and that is the Cushman breathing. You see the Cushman breathing, right? The main problem is what? Dehydration. So they are dehydrated. Okay. So when they come into the hospital, your number one thing is fluid. So you give them fluid, followed by insulin to push the glucose back into the cell. Then there's this one, potassium. Yeah, potassium is normally very high because you need insulin to push potassium in. But as soon as you give them insulin when you treat it, their potassium go low. So for diabetes patient, when they come in and you start treating them, you need to replace their potassium. Even though their potassium may be like 3.5 or 4, don't wait on because it's going to drop down and it becomes profound hypokalemia. So you have to start treating them as soon as you start giving them insulin. So they usually, initially when they come in, this is a concept you have to know. Potassium is high. So when they tell you initial lab value, you see hyperkalemia. But during treatment, you see hypokalemia. So because of that, when you're treating them, give them potassium. I've given you all the content on DKA. So then we use it to answer the question. They always come in with abdominal pain, I think because of severe dehydration and other things. This is classic for DKA. Their glucose will never get to 750 because the body will not allow them. Is the HHS, that's the one that their glucose will get to that because they have insulin. If you don't have insulin type 1, they don't have insulin, your body will not allow you your sugar to get to 750. Otherwise, they will be dead. So they usually 250 to maybe like 450, 500, but 750 is too high. So this is wrong. Dry mucous memory. You are applying your pathophysiology. You know they dehydrated at the back of your mind. Patient is dehydrated. So I can use that. Don't worry. Look at the symptoms and just reapply it. Doing critical thinking because this is a passing level question. You don't expect it for them to give you an easy choice. Then you pick it and you go. So dry mucous memory, they want you to think again. So this is right. They dry. pH of 7.4. This is normal. So negative. Fruity smell. Yeah, this is the ketone they're making. So they smell fruity. So that's why. Rapid deep breathing. I said this question in such a way so that I want you to think. I'm not going to write Cushman breathing for you. You have to know what Cushman, because it's once again passing level question. So this is the answer. So it's F, E, this, and that. Same thing. We're doing the same thing back and forth, you see, and I hope you're learning something. It's a SATA question, last statement. Which statement made by the client require immediate intervention at discharge? Okay, I need to do what? Teaching. You write it down. All the sentence doesn't matter. Teaching, teaching, teaching. And what do I do? I need to intervene. 2 words out of that. A 50-year-old client was prescribed digoxin after a new CHF. So now it's on digoxin, and then I got to say something about it. Okay, if you say something wrong, I got to intervene. Then you ask yourself, okay, what do you know about digoxin? Digoxin is used for CHF. Okay, there's certain things you have to know about it. And there's side effect of the digoxin. I mean, they like this medication. What digoxin does is, I'll just give you a little bit of content. There is something on the cell, which is, we call it sodium, potassium, ATPase. It pushes potassium inside the cell and it pushes sodium outside the cell. Digoxin come and bind here where the potassium is and block it. And it disrupts the whole cycle because you need this movement. There's also a calcium channel here that allow calcium to come into the cell and causes the heart muscles to contract. If you disrupt this, calcium is not going to come in anymore. So that's what digoxin, very smart. And by doing that, It slows down the heart rate. Okay, so your heart rate can go low, but it also increases contractility. So it allows the heart also to pump. So it also slow down. It has so many mechanisms. So you slow down the heart. That's why it's very important. The key thing is your potassium should be normal. You should avoid low potassium because if there is no potassium, the digoxin will bind all the areas that potassium is supposed to bind. It binds the potassium level site on the channel. So if potassium is low, you have more digoxin binding, and it creates toxicity. This concept is a little bit difficult for people to understand. So low potassium will cause digoxin to bind more, and it causes toxicity. But the caveat, you shouldn't take any potassium to increase it because the digoxin actually, if it's blocking potassium from being pushed into the cell, the digoxin actually increases your potassium already. So it's going to give you hyperkalemia. So you shouldn't add any more potassium in it. At the same time, your potassium shouldn't be lower from the beginning. So it's a problem, right? So that's how everything is connected. It has a couple of side effects. Okay, your eyes. So the way I remember, you come from the top to down. From your eyes, you have an eye problem. Okay, it has a neurological side effect. It also has cardiac side effect, and the GI side effect, and the kidney side effect. So from the top down. So we're going to answer that. Use that to answer it. I will check my pulse 1 minute before taking the medication. Yes, for adults, you need them to do a full apical pulse. If the pulse is less than 60, they shouldn't take it. So this one does not require immediate teaching. So that's good. I will call my ophthalmology with a yellow-green vision, where that is a side effect of digoxin. You shouldn't call your ophthalmology. He doesn't care about it. You should call who? Your doctor. So this is good. This is how people can get this answer choice wrong. It's ophthalmology, but they even though it has something to do with vision, ophthalmology has nothing to do with it. It's not the one prescribe your medication. It's the doctor will know that this is a side effect. So it doesn't mean there's something wrong with your eyes. It's just the side effect toxicity. So this one we got to say, yeah, we got to intervene. Call your doctor. I will increase my potassium intake. Like I said, they shouldn't. So you have to intervene. I will take Zofran with nausea. This is key. Digoxin, the number one. Listen carefully. Number one side effect that shows there's toxicity of the digoxin. It has a narrow therapeutic effect, 0.1 to 0.5 to I think 2. You shouldn't. The number one early signs of the toxicity is GI symptoms. So nausea, vomit, diarrhea is not just stomach upset. You have to call your doctor right away. That is the beginning of toxicity. Remember, most medication that has a narrow therapeutic effect, the number one signs of toxicity is GI. It is like lithium. If you take lithium like that, the same thing. Trophylline is the same thing. They will trick you. They will say, hey, somebody is on trophylline now, he's having nausea. Yes, number one side effect. Somebody is in lithium, is having nausea. Yes, you got to call the doctor. The same thing, digoxin. If you have nausea, yes, that's a GI side effect. They shouldn't take no Zofran for that. You should let me know so I got to intervene. I'll ask my PCP to change my dietizam. Yes. So this is one thing you have to avoid in digoxin. Low potassium, low magnesium, and high calcium. So calcium channel blockers, you should not take it because if you block calcium, that means there's going to be high calcium in your system. So you should avoid calcium channel blockers. So this is right. So that's the B, C, D is the right answer. Very important topic with good question for you to think about that medication. Another one, teaching. The same strategy. We're not changing it. You read a SATA, which statement made by the patient indicate teaching is effective. Now, teaching is good, effective teaching. So I'm looking for something that is good. A client developed DVT and was prescribed this, enoxaparin. And then you ask yourself the content. You got to use the content and come back quickly. What is that? This is anticoagulation, but you have to know what kind it is. This is lower molecular heparin. Okay, so it's lower molecular heparin. So it's a form of heparin. Then you use that. You know the teaching you're supposed to. Somebody who is taking anticoagulation, there's a bleeding precautions. So every answer choice you write, bleeding precaution. And you're looking at each answer choice in the eye of these three statements. Okay? I'm looking for effective and a bleeding precaution. I'll require frequent lab work. This is why you got to use your content. You know that heparin, form of sub-Q heparin like Lovenox, you don't need any lab work. You just Coumadin. So this is not effective teaching. I will increase my vitamin K. Yes, you don't need to increase anything. Vitamin K is related to Coumadin. Coumadin block vitamin K dependent factors. It starts with 2, 5, 7, 9, and 10. So that one is gone. So this doesn't increase, it doesn't show effective teaching. I will continue to add garlic to my soup. So this is supposed to be soup. Well, I call them the 4 Gs, okay? Garlic, ginseng, ginkgo, and then one more. I forgot, it's not coming. But there's 4 Gs, all the Gs. Whenever you see anticoagulation and they bring the G there, don't take it. So garlic, ginseng, all those herbal medications, you should avoid them. And they all start with the G. So this is not effective teaching. I'll call my PCP for a black tarry stool. Yes, it's a bleeding precaution. Is the patient is going to bleed? So that's good. I will take aspirin for my knee pain. No, that's not effective. It's bleeding. So I'm going back to my 3 things. It's bleeding. I'm not going to the question and reread again. I'm looking at these 3. Is bleeding precaution? No, this is not good. Aspirin will let me bleed more. So that's not effective teaching. I will avoid contact sports. Yeah, what does that mean? When somebody hit me, I will bleed. I have bruises. If I'm taking anticoagulation, I will bleed more. Yes, I will do that. See, it doesn't have to be perfect, but it has to make sense related to your topic. You broke it down into that, and that will help you answer the question successfully. So I have a simple method how to do this, and I call it be sharp. Okay, not expected. So be sharp. So the first one is B. So when you see prioritization question, you should write this down and then analyze each question, each answer choice, and see if you follow this pattern. It's not the best. It's not all in all. It's not going to solve everything, but at least it give you a focus, what to pay attention to, and that will help you be able to eliminate answers. Remember, prioritization question means every patient is a priority. That is one person you have to see quickly and take care of it. So when you need to prioritize, you have to be sharp. And this is a breathing problem. So breathing. And breathing problem can be like anything that affects the lung itself or push on the lung. Okay, not just the tube, the trachea or bronchial. No, it's the lung parenchyma itself that is affected. So if I draw it like that, it's the lung itself. So if you have your lung, if this is the lung, this is the trachea coming down to the bronchial like that. The lung will be here. So anything that affects this structure, and that's the breathing, or anything that is pushing on it, like fluid over here, or the cage that surrounds it, or the lung is in trouble. An example is like pulmonary edema, okay, like a pulmonary edema. Put P in, you can put that one in pulmonary edema. Um, that's example of lung problem, or pleural effusion, okay, pneumonia and causing a lot of respiratory distress, you know, and that's the one I'm talking about. Then the E is electrolyte, okay, you have electrolyte. The common electrolyte is like magnesium, sodium, potassium, and calcium. Whether the level is low or high, that's what you worry about. Then the S, first S is sepsis. So like infection, and look for the word rigidity. Rigid in the abdomen, rigidity in the abdomen. And the infection will present like fever, tachycardia, and hypotension. And then the other S, the same, there's two S, is shock. And you expect them not to give you shock like that. They will just tell you low blood pressure, okay, tachycardia, and then change in mental status, okay, or urine output is low, okay, that's the X. And then the H is also two. It's like hypoglycemia. So somebody sugar that is low, like less than 60, or hypothermia, temperature. If temperature is low, like less than 95 or 96, yes, I'm worried about it. I have to be sharp about that. And then the A is airway. So A is like airway. And airway, like I said, is this tube. So anything that affects the trachea, the bronchial, or the upper portion of it. And you should be looking for these keywords: restlessness, okay, or stridor, or somebody who's drooling, or patient is granting. These are keywords you're looking for in the answer choice. If you see, you're picking it up. So you write it down and you put this information on each side. It said, this is every prioritization question. You just go to that thing and look for it. Or somebody who is anxious all of a sudden, as all of a sudden the patient is anxious. It's not normal. They're having airway issue. And then the R, I call it the R. The R is the neurological problem. So a patient that is lethargic is not good. Or a patient who just had seizure, patient who just can get confused. Yes, you should be worrying about this patient, or changing mental status. Okay, those those are the ones you should worry about basically. So this is the R portion of it. And then the last one is very important. That is the P. You see, every patient has pain, but what kind of pain should you worry about? They can give you a bunch of patients, they have pain everywhere, but which one should you worry about? You should look for pain that is going to cost their life. So life, limb, and eyesight. So pain that is causing life is like somebody who have chest pain. If you don't do something about it, they're going to die. Somebody who has like a ischemic abdominal pain that is so painful, the rigidity, that is peritonitis, sepsis, is going to cause their life. The limb is like somebody who has a cast in their leg and you're giving them pain medication, is not helping. That is compartment syndrome. They're going to lose their leg. Like somebody who has testicular torsion, that kind of pain is not just pain. If you don't do anything, they're going to lose their testicles. Like somebody who had a what we call hernia that is incarcerated, that's a life, that's a limb. They're going to lose it. Like rhabdomyolysis, somebody have muscle pain and kidney problem from taking probably statin medication. Now they're getting pain in their muscle cramps, and other thing that you should worry about. And of course, your eyes, acute glaucoma or retinal detachment, that kind of pain is what you should worry about. Not somebody who has um, kidney stone pain or sickle cell patient who has pain or somebody who fell down and not a fracture. Don't worry about it. All you need to care about is life, limb, eyesight. And that is when you're doing that, you are being sharp. And so that is what it means by being sharp. So we're going to use that to break down this question. And the way you go by this is start from the top, read the first one. The first one is always your priority. Go to the second one, and then try to see which one now become your priority. Then you pick it and you eliminate the other one, and you go down. You keep on going down to the last one. So we're going to look at the first one. A client who has previous surgery 3 days ago, now reporting left calf is warm and touch. There's clue here. Surgery, and then calf is warm and touch. Where did he have the surgery? This is how you break down the question. Pelvic surgery. How did somebody have a pelvic surgery? His leg is warm 3 days later. We did not do anything to the leg or the calf. This is a sign of DVT. So this patient has DVT. DVT turns into breathing problem. So and it's bad. Pulmonary embolism, and they say this is a breathing, is affecting the lung itself. So pulmonary embolism, pulmonary edema, you see PE, they both have PE, pulmonary edema, pulmonary embolism. I'm picking these patients. So this is now our priority, but we have to look at the rest. A client who has endovascular repair of abdominal aortic aneurysm now with cold foot. Okay, fine. He has all these fancy words. Just means he has abdominal aortic aneurysm repair. They repair it, but his foot is cold. You should expect his pulses to be normal. But now his foot is cold. That means there's no blood flowing. This means the graft has thrombosed, graft thrombosis. Even though the foot is cold, if you don't do anything, they will lose the alarm, but you may have to do something about it later. You have some time to go and break down the clot. Therefore, I will keep this. This is a breathing problem. This is a pain that will lead to life and limb. This is more priority. So I eliminate this. A client who has thyroidectomy now complain of inspiratory stridor. You see the keyword there, stridor. He has thyroidectomy. He's bleeding into his neck. Now he has what? Stridor. Stridor is airway. And among these B sharp airway, this is my number one. So I eliminate A and I take C. A client with sickle cell disease reporting back pain. This is expected pain. So if I choose that, I'm not being sharp. For me to be sharp, I have to pick my number one, which is my airway. So this is the right answer, C. And that's how you can break down. When you're doing this, breathing, looking for PE or pulmonary edema, and the pulmonary edema, look for fruity pink sputum. That's the right word, they will tell you. Fruity pink sputum, yes. Then you look for electrolyte. This is, can go down or up. Sepsis, rigid abdomen, infection, bleeding, shock, and then hypoglycemia, hypothermia, airway, lethargy, and pain that lose the limb. You are being sharp about it. So that is how you go about answering these kind of questions. Priority. You got to be sharp with priority. The same thing. We have to be sharp. So we have to be sharp. So we have which assessment finding is a priority. A nurse is caring for a 5-year-old client with Kawasaki disease. Which assessment is a priority? We have to be sharp. So we're looking for something that is a priority. I have an easy way to remember Kawasaki disease, and that is how we use these two. The best way to remember Kawasaki is SAT cream. And S means strawberry tongue. They have strawberry tongue. A is aneurysm. T is temperature for more than 5 days. C is bilateral conjunctivitis. R is rash. They have a rash from the head to toe, from the neck down, on all their face. Then E is they have edema and erythema. And the A is they have lymph node, anterior cervical node, that is greater than 1.5 centimeters. And the M is mucositis. So this is a problem that we don't know. We think immune respond, they respond to some viral infection, and the kid mouth is all red, the tongue is swollen, they have fever more than 5 days, and then they have all these symptoms. The priority symptoms for this patient, the priority symptoms for this patient is aneurysm. So this is the priority patient. This aneurysm is the priority. They get what we call coronary aneurysm, and this is what killed them. The treatment for them is, this is all knowledge base I'm giving you, aspirin and immunoglobulin. And your priority function is aneurysm. When they give you any question on Kawasaki and they're not asking you about aneurysm, don't pick it. But they have all these symptoms, all this will go away. But you have to be sharp. Aneurysm lead to hemorrhage, which is shock, and they die, they perforate, the aneurysm is hemorrhage. And so we're going to use that to look for the answer. Anterior cervical node of 1.5. Then you tell yourself, well, this is what I see on the SAT cream, but that's not a priority. It's a physical finding. It doesn't kill the patient. You are not being sharp. Strawberry tongue, fine. It's going to get better from it. Temperature of 5 days, fine. Coronary aneurysm is the best way to go. You are being sharp. You're using the B sharp to say, okay, I'm looking for shock, all those things. If you have aneurysm, it's rupture and it bleeds. So that is the way to apply this technique. This is how you can apply it. And I hope you get something out of it. Take care of yourself and see you later. All the best of luck.